testicular self-examination. The definition for this is that examination of the testicles and scrotum through inspection and palpation to detect any abnormality. The purpose of STE is to detect any type of mass, lump, or swelling that may be malignant. For the assessment, we assess the knowledge of the patient, assess the size, shape, skin, color, distribution of the hair, and symmetry of the testicle and scrotum. For the planning, we acquire knowledge and return demonstrate the procedure. We choose a consistent date of each month to perform the procedure. It is to accurately teach the client in doing the testicular self-examination, and for the implementation, we identify and verify the client. We explain the procedure, and of course, we provide privacy by closing indoors, windows, and curtains. And we wash hands. It is to prevent the spread of infection. And then we demonstrate the procedure as follows. First, we stand in front of the mirror, look for any swelling on the skin of the scrotum. And then we examine each testicle one at a time, placing your index and middle fingers of both hands on the underside of your testicle and your thumbs on the top side. This may be easier to do if the leg on that side is raised. And then we firmly roll testicles between your fingers and thumbs, carefully feeling for any lumps, growth, or sensations of tenderness that don't feel normal. It is normal for one of the testicles to be larger than the other. And then we locate the spermatic cord or vas deferens, which extends upward from the scrotum toward the base of the penis. It should feel firm and smooth. After you have examined the testicle and cord, check the opposite side. And then we inform the client to become familiar with how his scrotum feels, so he will be able to tell if there are any changes over time. Testicular cancer may not always create a noticeable lump on the testicle. Other clues to look for include as any changes in size, shape, tenderness, or sensation of the testicle or scrotum. A change in the consistency or swelling of the testicles or scrotum, and then the pain in the testicles or scrotum, a dull ache or heaviness in the lower abdomen, and an abnormal or persistent backache, unexplained weight loss. And then we have here the breast development. We encourage the client to examine his own testicles and scrotum while you are there to help. And then do aftercare, wash hands, evaluate client's understanding of the procedure, and evaluate any abnormality and client's response. We record and note observation and client's response and report any unusual findings to the physician. Lastly, the points to remember. All men should perform a TSE once each month from the time they are 15 years old. Ideally, testicles should be examined after a hot bath or shower because the warmth will cause testicles to descend, the skin of the scrotum to relax, making it easier to feel any lumps, growth, and tenderness. It is normal for one of the testicles to be larger than the other.